back when surgery really got going, in the 19th century, all the hospitals' operating rooms had skylights. They had to be on the top of the building so you could let the light in before electricity. That was much better than it is now. Anyway. But Jim, thank you for that nice introduction. I got interested in Andy Warhol due to a photograph I saw probably, oh gosh, I think 14 or 15 years ago, but I didn't really get interested in him until 4 years ago when I went back to that photograph and wondered. It was a picture of Andy Warhol with a bunch of scars on his body, and I just had never seen anything like it. And I have no real background in art at all, but I've been involved with operating rooms since 1961. When I was in high school, I worked as a scrub tech in the operating rooms in Grand Rapids, Michigan, passing instruments to these general surgeons. And here comes my friend, Dr. Dick Dion, who I have a tremendous relationship with because he raised all three of my children as their pediatrician. He was very good. But this talk about Andy Warhol, I've given a talk about a gunshot injury he had. There'll be a little bit of that in this talk. But this is mainly going to lead up to the time that Andy Warhol died after a surgical procedure. And this death was very unexpected. It was an unexpected adverse outcome. That's the phrase they use nowadays. Anyway, he died right after the surgery, and we'll talk about that. But the main purpose of this lecture, which I've given a number of times now, is to describe what a medical center should do, what a hospital and all the doctors should do when there's an unexpected adverse outcome. And I know that you have experience with family members or parents or whatever, and some of them's experience in the hospital probably wasn't perfect. No place is perfect, and when that happens, what should the medical environment do, and what should the community environment do? So that's what this talk is leading up to. But we'll have an opportunity to review a little bit about the life and the art of really one of the most prolific artists and creative artists of the 20th century. So let's be a little review of his life and some of his art, and then we'll get into the serious issues about his health care. Andy grew up poor in Pittsburgh, created art in college at Carnegie, moved to Manhattan, soon on the A-list of artistic advertising in the Big Apple. Fashion was his forte, particularly footwear. And he was very successful at it. As a young graphic artist advertising, he bought this townhouse on the Upper East Side. And as he became more and more famous, he became more and more wealthy. And he bought a big compound out on Long Island. And later, he had a very fancy townhouse on the Upper East Side. His mother was a real mama. She moved in with him in Manhattan. And he was a little bit of a mama's boy. And he enjoyed painting his mother. He professed that he had a problem. He was openly gay, and in his art. That's his word, not mine. But he wasn't really an advocate, but he was active. He was very interested in money. And he made a lot of money. And he painted a lot of money. And he said, well, who would think about putting a red rubber ribbon around a roll of bills? But he said that making money is art, and working is art, and good business is the best art. Can everyone hear me? I think this is a fantastic painting. Since I got interested in Andy Warhol, I've seen many of his paintings, not on purpose, but just everywhere you go, they are. He was very interested in fame, and he became one of the most famous people in the world. And he coined a phrase, which you're probably familiar with: everyone will be famous for 15 minutes. But he was a dissembler, and he didn't like to be pinned down, and he didn't like anybody to really understand him. He just kind of a funny guy. So when people would ask him about this quote, he said, "Oh no, I didn't say that. I said in the future 15 people will be famous." Or they'd ask him and he'd say, "Oh no, in 15 minutes everyone will be famous." So he was like, he didn't want to be categorized. And he had these strange, as he got older, he had these strange characters. He would dress up like Dracula or Cinderella, and then he combined that as Drella. So he was creative in his self-expression, let's put it that way. When it comes to his art, it's very hard to categorize it in any way because he was so prolific. But for the purpose of this lecture, because we're leading up to Andy Warhol's death, I'm going to show a lot of images that he did that have to do with death and dying. And here's one of his most iconic paintings out of Marilyn Monroe. And he started silkscreening Marilyn, and here's kind of a death image of her. He started silkscreening Marilyn the day she died of an overdose of pills. He was just 2 years older than Andy, born in 1926. He was born in 1928. I think he did this silkscreening from a publicity still from a younger time. He saw Marilyn as an object of desire. And he knew we couldn't have her, but maybe we could have our favorite color of her. But the more I looked at this, I realized he used a lot of the color red. And in many of his silk screenings, red was a dominant theme. And it had, as I've looked at it from my point of view, it had two meanings. One is the vitality of life, that blood going through your bloodstream, but it also comes out to have bleeding and trauma and leading up to death. So these were these images. He created a bunch of them in 1962, and then in 1967, he put some other images, and they're quite startling when you look at them, because look at the red color now. It's really kind of offbeat. And I think he finally, in 1967, this is 5 years after his death, I think he accepted her death because he painted her in black and gray. But Marilyn wasn't the only real prominent woman of the 60s that he painted. He painted Liz Taylor. And in 1962, she had a very bad year. She developed pneumonia. She almost died of it as a young woman. She had a tracheostomy. She dumped Eddie Fisher, you'll remember, divorced, and took up with a dissolute Richard Burton, and then she was involved that year with this financially disastrous film Cleopatra. So although Andy Warhol painted her in the vitality of this picture, he also painted her almost with tears coming down her eyes in 1962 from Cleopatra. And then, of course, the nation's widow, Jackie Kennedy, with this amazing collage. It's all painted. It looks like photographs. It's painted from photographs, but here all happy in her pillbox hat with smiling Jack in the background, and then the tragedy of the funeral after Kennedy was assassinated. So these three women painted here with the vitality of red, also death images in black. And then Elvis, you know, the red excitement of gunplay. But what does that lead to? I mean, really, it leads to death when bullets come out, and particularly if he's pointing right at you, either in New York here at MoMA or at the Seattle Art Museum. He had more fun with Campbell's soups. In this 32 varieties, which he did in 1962, was a tremendous sensation. Nobody had ever done art like this before, and it captured the imagination of the art world and many of the American people. He liked Cokes. A lot. Lots of them. And his paintings, I think, celebrated the democratization of consumerism. And he was also pretty profound in some of the simple statements he would make. And so one of them just caught my imagination. The Queen can't buy a better Coke than you can. You know, there's nobody here in the audience that the Queen can buy a better Coke than. Nor neither can the President. Andy Warhol knew Donald Trump back in the 70s and 80s in New York, and Trump commissioned him to do a painting of the Trump Tower.
Oh, really?
But when it was done, I think there were 8 different visions of it, Trump refused to pay him. I wonder if that was part of his long-term character, belching on a deal. Well, getting back to death and disaster, Andy painted a whole series of disaster. Here are the bull conners barking dogs of Birmingham. And you can see the red for the bleeding of dog bites. And he painted death, usually from newspaper articles. And this was a silkscreen painting, this horrible car crashes. And he got people involved that had been in car crashes later on, like James Dean, who died in 1955. And then this horrible painting of, all in red and black, red for bleeding and black for death. Can you see that all right? Is that projecting on the screen? Maybe, I wonder if we should, can we turn some of these lights out? Can you turn the lights out up front? Because I think some of the images are, yeah, oh yeah. Hey, thank you. Just don't lean back. And again, later, people who died in car crash, Princess Grace, and this is really interesting because there's all the red in the background, and then she has a sort of a blue, unusual blue, I don't know if it's projecting the same on my screen, as a kind of a death mask for her face. And then a black shroud. And this is interesting, electric chair, all in red and black. And he kind of wryly mocked his patrons that would buy this. He said, you'd be surprised how many people want to hang an electric chair on their living room wall, especially if the background color matches the drapes. But he had a whole series of disaster and death in the early 60s, which is somewhat a premonition of his own disaster, the gunshot injury he had in 1968, which we'll talk about, and then his death in 1987 after gallbladder surgery. Well, a lot of his art took place in his studio, the Silver Factory, where he had a lot of, in this picture, a lot of associates and assistants, and these were the factory workers, kind of an avant-garde group. He always had a superstar. Even though he was gay, he had a woman, Eddie Sedgwick, was one of his most popular. She was a doppelganger in hair, fashion, and attitude. And he put her in this famous screen test and in underground films that he made, and he painted her, but eventually she ended up dying of a drug overdose. This is a woman, Valerie Solanas. She wanted to be part of his retinue. She really didn't qualify. She was the president of SCUM, S-C-U-M, the Society for Cutting Up Men. She'd been in one of his movies called I Am a Man, and then she wrote a screenplay called Up Your Ass, and Andy rejected it. And so she shot him. That was it. And he was taken to this really small hospital in New York City. This was before there was any trauma systems in major cities. You have heart review right there if somebody slips and falls, or worse. But they didn't have it. In New York City in 1968, no trauma center. So he was just taken to the closest thing, a Columbus hospital, which had been formed for some Italian immigrants. And he was actually pronounced dead by some of the interns that were working in the hospital. But he was revived by this young surgeon, Dr. Giuseppe Rossi, who was an Italian immigrant who just happened to be kind of walking by. And Dr. Rossi told me many years later that the bullet that hit Andy Warhol struck his right chest, pierced the lung, nicked the anterior wall of the inferior vena cava, that's the largest vein in your body, punctured the diaphragm, transected the junction of the esophagus with the stomach, lacerated the liver, perforated the colon, shattered the spleen, ruptured the diaphragm, blasted the lung, and fenestrated the left chest wall. Which just goes to show you, if you want to create damage, shoot somebody sideways and not front to back. You may only get one organ this way. Well, anyway, 9 organs involved, and Dr. Rossi, 6-hour operation, took out part of the lung, the liver, part of the colon, all the spleen, repaired the diaphragm, repaired the esophagus, repaired the inferior vena cava. Big deal, 12 units of blood transfused. You know, the human body only has about 10 bags of blood, so he was in real trouble. And at the end of all this, the surgeon was totally exhausted. Dr. Rossi gave me this picture. It wasn't of the same day that he operated on Warhol, but it was it looked kind of like that, what he might look like after that experience. He was really an unknown surgeon, just been in the United States a little while, and he didn't even know who Andy Warhol was. And the next day he did a tracheostomy. You can see these scars. This has never actually been reported. You're some of the few people in the world that know that Andy Warhol had a tracheostomy. You can see the scar there. And of course the newspapers were just all over this event, because by 1968 Andy Warhol was very famous in New York and throughout the country. And this is interesting to me because I'm going to show you several newspapers. And the Daily News was one of the ones in New York, and it had the same headline, but 3 different pictures. Look at this, it's all the same day. Kind of weird. In the New York Post, Andy Warhol fights for a life. There's the pictures of the 2 principals, the assassin and the nearly assassinated. But in the later edition, they just turned the pictures around with the same headline. That's when newspapers came out every 15 or 20 minutes in New York. But this is interesting. In that same headline, voting in California. Because on June 4th, the Democratic primary for the president was going on in California, and as you may recall, Robert Kennedy, LBJ had dropped out of the race, and Robert Kennedy was running. He won in California and was then expected to be the 1968 Democratic nominee, but right after midnight he was shot and died. And Andy was kind of waking up from his operations in New York City, and I think a little confused, but later he said, as I was coming down from my operation, I heard a TV and the words Kennedy, assassination, and shot. I just thought that maybe after you die, they rerun things on TV for you, like President Kennedy's assassination. Well, his troubles weren't over after this major operation, life-saving operation. He was in the hospital for several months. In August, this is 2 months after, more than 2 months afterwards, he had an abscess where the spleen was and where his colon had been resected, and that had to be taken out from the back with a rib resection to drain the abscess. Well, eventually he got out of the hospital. He doesn't look too great here, but this is in November, in the fall of 1968, with a couple of his superstar women. You can see he looks a little sallow in the picture. But he was pretty excited because he knew that the 5th anniversary of the President Kennedy assassination was coming up, and he wanted to do some art for it to commemorate it. He was very committed to this whole thing and saw it from different angles. So he took the newspaper from 1963, now 5 years later, he turned it on its side, he covered it with a bunch of round objects, kind of like bullets, made it into a thick cardboard, a folder for a portfolio of paintings that he did. And here, real life scene was like a take from a movie. Jackie Kennedy, Lee Harvey Oswald, the rifle, the Texas Depository window, smiling Jack covered with half-tone dots like bullets, bleeding, splattered, dead. And later he painted Edward Kennedy all in black. I think he was worried with the Americans colored behind him, not really the flag, but just the American colors, and he might be the next one. But Andy's health problems weren't over. Through that winter, he was not feeling well, he'd lost weight, he was thin. And what he had was a chronic infection in his chest where he'd had part of that lung removed. And so that was, on March 5th, Dr. Rossi took him back to the operating room and opened a small thoracotomy. You can see it in this picture that's done by Richard Avedon, this photograph. The scars on the left chest, he's turned kind of sideways to you like this. And then he also had a fistula. That's a communication between the colon. When he'd been shot in the colon, they put that back together, but it leaked a little bit and came out of drain tract on his side. That's a colocutaneous fistula. I know there's some doctors here in the room, but I know that some of the other words may not be totally familiar to everyone. And I would also just say, if at any time you have a question, this is a pretty relaxed audience. We can stop and talk about either the medicine or the art. But anyway, so he was operated on again on March 5th. He's both a thoracotomy and a laparotomy to take care of that fistula, and it all worked. He's all better.
Is that his picture, John, his drawing, or is that Dr. Rossi's drawing?
Well, if your eyes were any better, you'd see initials J.A.R. down there. Those are my initials. I drew that.
Oh.
But I I drew it with the full knowledge of Dr. Rossi, who told me a lot about the operation. None of this stuff has ever been published, what it was done to him, but years later. I mean, he talked all about it, and the newspapers had all kinds of things wrong about it. That's a different talk. But it left him really a frightened artist with a torso full of scars and a hand reducing a large incisional hernia. The abdominal part of that came apart. So this was actually the photograph that got me interested in Andy Warhol, because, you know, I'd never seen anything like that in my life, and I've been involved with surgery for almost 60 years by this time. So, this really affected Andy Warhol, as you might imagine. He fixated on the emotional trauma of both the gunshot violence and also the major operations that he went through. And he strangely reinforced this by posing for pictures of his scars over the next several years. Here's a selfie he took of himself in a mirror at the hospital. In paintings too, this one by Alice Neal, who was 70 years old when she painted Andy Warhol wearing this corset. And this was just, it wasn't 1970, so it was just a year and a half after the gunshot injury. In the same year, she painted a painting of herself, which I think is fabulous. Amazing. More pictures. There's one of the hernia. He wore this corset to hold the hernia in, that are all pointed out there. Paintings in the back. I mean, really, how many middle-aged men do you know that have this many images of themselves without a shirt on? His whole social network changed after this. He was involved with some pretty weird people before, but he found pleasure in publicity to popular people whom he painted. He took Polaroid pictures of prominent personalities, and then he'd project them and screen them and paint them into portraits. Priced to the patrons at $40,000 a piece, even if they were his friends. And limited reproductions provided to the public at profits. One of these really caught my eye, and that's a painting of Georgia O'Keeffe, 1979. And I just saw this recently in Palm Springs. It's huge. And he also painted her with that same picture with a red silkscreen to give her the vitality of life. But she was 90 at the time. I think they had a pretty good time together. It looks like they're having fun. He was always very religious, even though he had kind of a weird outlook. He was a Roman Catholic from birth, very religious. But after this gunshot injury, he started going to church more often 3 times a week. And he said some interesting things about church. He says, I think it's really pretty to go to church. The church I go to is a pretty church. And of course, as a Catholic, he had to give confession from time to time, but he said, I never feel I do anything bad. But he took some of the real masters of religious painting here, Leonardo da Vinci's Annunciation, with the angel in her hand and Mary's hand up, but he kind of gave it his own reading, just put the hands in.
Oh my.
And then he took Raphael's Madonna and Child and made it his own. And this is kind of fascinating, because here baby Jesus, the boy, he's got the blue robe, and then lying kind of prostrate on the side is a pink baby. I don't know what he was trying to say, and I don't know why there's $6.99 is the price tag on this whole deal. I mean, you know, people have written books on different paintings like this. And he did his Polaroids again of the nursing mother and made them into drawings. But he did these religious symbols of death, crosses here in black, and then in red and black. You know, red for, well, I don't know if it's red for the bleeding that was on the cross, or red for life and black for death, but clearly a death image. And you know, in the Catholic Church, the repetitions of Our Fathers, Hail Mary as Our Fathers, that came pretty natural to Andy Warhol in these paintings. he met the Pope in 1980. And I wonder what he thought. Just a year later, when the Pope was also a victim of gun violence and underwent major surgery to save his life. But the fact is, we know what he was thinking, because right after that attempted assassination, Andy Warhol started his pistol paintings in red for bleeding and in black for death. And then he did the knives in red and black, and in black and red, many varieties. And then he put it together, guns, knives, and crosses, in an exhibit that he did in Madrid, kind of brutal there in black. And he had other experiences with his paintings that led to death. This was kind of a corrupted Polaroid that he took of John Lennon, the Beatle. And he made it into the album cover for probably his most famous song, Imagine. He was good friends with John Lennon. They were very close. But then in 1980, he did a big Polaroid, and I think he was going to do a whole series of silk screens. But right after that, before he could do the silk screen, John Lennon was assassinated. And Andy Warhol kind of let that go. I think he was in mourning, but Yoko Ono, Lennon's wife, 6 years later, wanted to put out a posthumous album, and so she said, you can go ahead and do this on 86. So there's kind of bleeding, dried blood, blackness of death. But I don't think he kind of wanted to let it go, so he gave him some of that electric blue hair for this album, Menlo Avenue. That's actually the avenue that John Lennon grew up on. He was friends with Gianni Versace, the designer, and he painted, this is a Polaroid, and they painted him, really, that's a death mask to me, in the negative. Well, Warhol died 7 years after this painting, and Versace was so taken by that he put out a whole wardrobe of Marilyn Monroe and James Dean fashions as a tribute to Warhol. But you know, I mean, that picture's lingering there and kind of almost a prediction when Versace was assassinated. Some of these things are just kind of weird, but in the 70s, he did all these great sports. Is that you, Peggy?
It's me.
Nice to see you. Don't worry, we're getting to the good part.
I know.
But anyway, he painted all these sports stars, Ali and Kareem Abdul-Jabbar and Pele and Willie Shoemaker. I don't know, you can name them all. Right in the center, who's there? O.J. Simpson. And he did this from a Polaroid. He did all these Polaroids first, and then he'd do the silk screens from them. And he did a really, I think, interesting thing with these silk screens, because he darkened O.J. until all that was left was this dark black of death and this red football. And, you know, of course, years later, with a violent knife attack, or he was accused of, you know, killing his wife by this brutal knife attack. It's just kind of foreshadowing of what was to come. But when this actually happened and that O.J. was arrested, a different picture was on the cover of Newsweek magazine, Trail of Blood. But Time magazine, Andy Warhol was, of course, dead by this time, but Time magazine took that same photograph and put it on the cover, completely darkened, just like Andy Warhol had done before. And these weird things keep happening to Warhol about his images of death. Some of them are quite predictive. He did Elvis, red and black. Of course, he died of an overdose. He did Michael Jackson in '84. After Warhol died, Jackson died. There's still red and black there. Prince, red and black, predicting his death years later, overdose. Well, finally, he just gave up these subtle reminders of death and just went straight to the skull. You know, there are not any live skulls around, red and in black. And I saw one of these just recently at the Palm Springs Art Museum, a different color, but kind of gray and black in the background. And when you get that close to a skull, you realize there's not that much between you and what's going to happen to you. But Andy said about death, oh, I don't believe in it because you're not around to know that it happened. That's encouraging. But lots of images of skulls in red and in black. And back to Maryland later on in '78, couldn't get enough. These images, then even darker images of Maryland. Double death. he did this interesting self-portrait in which he seems to be aging or dying. But really, what's the difference? And then James Dean, on the 30th anniversary of his death by car crash, he came out with this movie poster for the Japanese were going to put Rebel Without a Cause on their screen in 1985. And here it is, red and black again. And in the background you can see James Dean dying. And then John Gotti, the gangster, here with the big red patch. 86 was interesting. That's the year that he became the head of the Gambino family after murdering Paul Castellano. So he was in the news a lot. This picture was in the news, and Warhol silkscreened it. But he put that big red blotch, you know, like blood, and then all the money he made from his gangster activities, and then his suits all in black. But he was considered kind of the dapper Don, evil man. Ended up in prison. I think actually Mayor Giuliani was the guy that got him. Even the mayor, he was the prosecuting attorney in New York at the time. He's been in the news the last couple of days. Of course, he did some political paintings too. Here's Red Lenin. Really, I think for the Red Terror of all the people murdered at the time of the Communist Revolution, and Black Lenin for Black Death. And he'd been very interested in Mayo. He said, I've been reading so much about China, they don't believe in creativity. The only picture they have is of Mayo. It's great, looks like a silk screen. Of course, that's all it took for him to start silk screening Mao Zedong here, the bloody Cultural Revolution. I mean, the blood of all those people on his lips is horrible, and that dried blood on his face. Just an evil man. And he wasn't subtle about this painting. In black. Many of his self-images, I think, were death masks, like these camouflage ones, where he's kind of hiding from death, all dark. But he certainly wasn't hiding from death here, picturing somebody strangling himself, looking up to heaven, I think. A lot of those are red and black. So many images of death. Death by human violence, car casualty, overdose, depicting death, predicting death, politicizing death, mourning death. Andy mourning Marilyn, and Jackie mourning Jack. The tabloid mistress and the married magnifying their misery. Institutionalizing death, remembering death, imagining death, obsessing about death, just missing his own death, misinterpreting death, and worrying about death, and symbolizing death, and deifying death. Warhol's last work was The Last Supper. It opened in Milan on January 22nd, 1987. A whole exhibit. Andy was there. Exactly 1 month later, he'd be dead. I wonder if he saw himself as a Christ-like figure and his factory workers as the 12 disciples, because it's almost like this group painting that he copied from Leonardo da Vinci by coloring it, like stained glass windows. And who wouldn't want to have ketchup at the Last Supper? Or smoke a Camel afterwards? Or wash your hands with Dove? Or clean up with the GE dishwasher afterwards? But Andy didn't look so well. And he didn't feel so well. So he came home early from the exhibit to experience the last 2 weeks of his life. On Sunday, he had too much pain and wasn't able to go to church, which he did religiously. In the early in the week, he tried to work, hurt too much, he had to go home early. He went to this pre-Valentine's party with some of his friends. His doctor was there. He didn't say a word about how bad he was feeling. His friend tried to give him some chocolate on Friday. He couldn't eat it, too painful. On Saturday, he saw his dermatologist. Apparently he was getting a lot of collagen injections and things, but he told her he was in severe pain. Dr. Burke here, his dermatologist, got a ultrasound of his gallbladder showing stones. He'd known about these stones before, but he'd never had any attacks like this. Still couldn't go to church on the 15th. He thought he might feel better if he got a massage from Lindy Lee on the 16th, on Monday. But during that massage, he had more pain radiated to his right shoulder, and he had fever. These are all signs and symptoms of increasing gallbladder distress. On Tuesday, he was supposed to be in a fashion show with Dionne Warwick, but he told her he thought he was going to die. And on Wednesday, he finally called his doctor, Dr. Denton Cox, and said, "I've been sick for 30 days. Now, Dr. Cox was very well educated, Yale undergrad, Columbia Medical School, trained at the New York Hospital. He became an Upper East Side New York society doctor and had been Warhol's personal physician for many years. And he'd actually diagnosed gallstones from the oral cholecystogram, a thing they don't do anymore. But I had to put it up just for fun. Now ultrasound is very good for the gallbladder, but in the old days you had to do this other crazy test to get contrast telepaque into your gallbladder and show that layer of stones there. Dr. Cox had also been prescribing Andy a number of drugs, and one's called Obitrol, which was really a drug that was in the 50s, 60s, and 70s for weight loss, but it's actually the same drug that they use for hyperactivity and attention deficit disorder. What do they call that drug now, Dick? Ritalin, yeah. It's the same ingredients, amphetamines and methamphetamines. It's called methamphetamines, has a street name of ecstasy. The whole thing combination is called speed. And he took this for many, many years, just mainly to try and make sure he didn't gain weight. But anybody who has a prescription regimen that's got Obitrol and Drinamil, which is kind of a combination of uppers and downers, and then Seconal, which is for sleep, you know, you're taking speed, Purple Hearts, and Red Devils, that's going to turn your world upside down. So Andy said, "I've been sick for 30 days, and Denton Cox said, "I advise surgery." And he sent him to see Dr. Bjorn Tharp-Jarnarsson, one of the most famous surgeons in the country, a professor of surgery at Cornell University right there on the Upper East Side. And Dr. Tharp-Jarnarsson saw that he was emaciated, dehydrated, dissipated, demoralized, and he thought maybe he was drug addicted. But Andy said, "Oh, I don't take drugs, I work out every day." Now, in the physical exam, he wasn't jaundiced. He was very tender in the right upper quadrant where the gallbladder is, and he had this giant incisional hernia left over from the gunshot injury. So Dr. Tharp-Jarnarsson recommended operation, and Andy said, "I'm going home." So he was deathly afraid of hospitals. He called Dr. Cox the next day. "I have a chill." Dr. Cox got another ultrasound. This time the gallbladder was more inflamed. It shows those stones in there. I think you can all see them in the gallbladder. He sent him to see a gastroenterologist who said, "You should come into the hospital." And Andy said, "Not today." So on Friday, he finally called Dr. Cox. He said, "I got to go to the hospital. I'm that sick." So he was admitted to the New York hospital, which was associated with Cornell Medical School, one of the biggest and finest hospitals in the world, and one of the leading hospitals, of course, in New York City. And he was admitted to Dr. Tharp-Jarnarsson's service, and Dr. Tharp-Jarnarsson and the resident came to see him, and the resident wrote in the chart that besides the gallbladder, he was otherwise healthy. Now this statement would come back, there's going to be some legal implications here, and this little statement in the chart would come back to haunt him. His electrocardiogram was normal. He got a lot of intravenous hydration overnight, which was very appropriate. And then Dr. Cox came to see him that night. And there was no note in the chart that he was on these amphetamines or methamphetamines or anything about his drug. He just said he wasn't on any drugs. But he had been for many, many years. And we know this because the prescription bottles are in the Warhol Museum in Pittsburgh. You can see all the dates on them over the years. He kind of kept everything. Well, Andy was watching Hill Street Blues on TV and making phone calls. He seemed just fine, getting the intravenous. And the next day was the day for the operation. And according to some reports, he wore a wig the whole day. He always wore a wig, but he wore it while he was having surgery that Saturday morning. Now, this is an important thing. While he was being operated on, the hospital administration called this private duty nurse, Min Chao, a Korean woman, For 10 years, she had worked at the New York hospital as a regular nurse, but then she became what, I don't think they have them so much anymore, but in those days they had the agency nurses. If you were wealthy, you could hire, I see somebody nodding in the back row, you could hire an agency nurse to come sit by your bedside at an extra cost to you, not covered by insurance or anything. And there's some irony in the next part of this, is that she had worked the 7 previous night shifts in other hospitals around the city. And when they called her Saturday morning to see if she'd come in that night, you know, they kind of woke her up from a sleep. And she had, the shifts in those days for a private duty nurse were 12 hours at a time. This whole work hours issue will become important in a little while. But she needed the money and she wanted the job, so she agreed to come in that night at 8 o'clock. So here's the operation. Of course, they were dealing with acute cholecystitis. That's inflammation of the gallbladder due to the gallstones. And they also had to deal with this large incisional hernia from the gunshot incision from before. So we'll just go take you through the operation. Here's the hernia, there's the incision. Had to do that to get to the gallbladder. Of course, when you've been shot before with all those organs, there's all these adhesions or abutments, so they had to fight through all that to get down to the gallbladder. When they got there, they found out, this is a picture of a gallbladder. If you're not too used to seeing them, the gallbladders look kind of sky blue and they're normal, and this one is all dead and gangrenous, the color green and red that you can see there. This is a bad gallbladder. This is not a normal gallbladder at all. This is not a routine gallbladder. This is a very sick gallbladder. But they marched ahead with the cholecystectomy, that's taking the gallbladder out. And they did it in a really, I think, a nice way. They put a needle in the gallbladder and sucked all the pus and corruption out, kind of collapsed it so they could handle it better, it wasn't so swollen. They cultured the bile and they put Mr. Warhol on an antibiotic called sulfoxetine. That would be a problem later because there's a very slight cross-reaction with penicillin, and there was a question mark whether you might have had a penicillin allergy as a youth. They dissected the gallbladder from the top down rather than from the bottom up, which is a safe way to do it. And they conducted the operation just beautifully. And they did what's called an intraoperative cholangiogram, an x-ray of the bile duct. You know, stones from a gallbladder can move into the bile duct, causing more trouble. So there's a little tube into the bile duct. The bile duct's the tube that comes out of the liver. And with the keen eye, you can see that the contrast goes into the duodenum like it's supposed to. There's no stones in the common bile duct. But in an inflamed situation, that's not always so easy to do. So this just was another thing that showed you how well the operation was going from the point of view of the surgeons and people observing. Really a very nice job. So at the end of taking out the gallbladder, then they had that incisional hernia to deal with. You know, to get into the operation, they had to go through the hernia. So the hernia means there's intestines just right underneath the skin. So they had to get all the intestines back in and close that big old hole they had there. There's a drain in the gallbladder faucet, which is another right thing to do. So here's how you do an incisional hernia operation when it's that big and when you've had pus and infection inside the abdomen. First of all, there's a big dome here, so you have to, it's best to take out a little extra skin so when you pull it together it's flat rather than all floppy. So they remove the skin. And then you can make a relaxing incision in the fascial covering of the rectus muscle. And that allows to pull the thing together without tension. So they did a nice cut down the rectus muscle and released it, and that allowed them to pull the incision together without too much tension. Really a nice thing. Nowadays, a lot of people put meshes or patches there, but you don't want to do that when there's infection in the abdomen. So it was just being complimentary of what they did. And then they did the skin closure. And all this was done in 3 hours and 25 minutes. This is a good job. Now, how do I know so much about this operation? Well, I've read the operative report. There's Andy Warhol's name at the top and the surgeon's name, New York Hospital. It was 3 pages long, but I read the whole thing. It was given to me many years later by the doctor who was 68 at the time. I interviewed him several years ago. He was 93. He remembered every single thing about this operation. He was living in a retirement home in New Jersey, and he had Andy Warhol's whole chart there, copies of it, because there's going to be a big medical trial. That's why this stuff is not privileged information. It's all been publicly presented. I was happy to meet him. My brother was a student under him at Cornell Medical School. Everyone has talked highly of this person, but he's unhappy because what's going to happen next, which we'll go into right now. But just a little bit about him, he was also an immigrant. He grew up in Iceland, he went to medical school there, but he came to the New York hospital at Cornell. He trained there in surgery. He spent his whole career as a general surgeon in the hospital. He was the interim chief of surgery. And he had an extremely famous patient a few years before, the Shah of Iran, 1979. And when he took out his gallbladder and also diagnosed lymphoma, the Shah stayed in the United States, and this precipitated, as you recall, the international crisis in which our embassy in Tehran was overrun. Of interest, this image of the Shah was painted by Andy Warhol 5 years before. Well, we'll go through the post-operative recovery here. Dr. Thorpe-Jarnason saw him in the recovery room afterwards, and he gave him a little bit of morphine. That's not a very big dose, and he catheterized his bladder. There was only 150 cc's of urine, not very much, so he gave him a lot more intravenous fluid. That's all very appropriate. And I'm just going to say that, preoperatively and during the operation, and then really it was an 8-hour period in the recovery room, he was monitored by electrocardiogram, and he didn't have one abnormal heartbeat. He was in perfect cardiac rhythm. And this is important. I know Jim is a ICU doctor and thinking about post-operative recovery. And nowadays, he would have left the recovery room and gone to a place where he could be monitored with all things. But this is 1987, probably not as frequently done. He had an 8-hour period of observation in which his recovery seemed to be going perfectly. No, he's going to be dead by this time the next day, so this is all important. And he did go up to this private room in the Baker Pavilion, which is, I think, a room for exclusive patients. I've never been actually in the Baker Pavilion there, but the Mass generally had a room with gigantic fireplaces, and the private duty nurses were more like a hotel room. So anyway, that's where he was at 4 o'clock. Dr. Cox came to see him right away. And he said, that gallbladder operation went so perfectly that they decided to go ahead and fix the hernia afterwards. Now that shows you, I don't want to be critical of medical people, but how naive he was, because they had to fix the hernia if they went through it to get to the gallbladder. So, but anyway, Andy didn't pay any attention to that part of it. He just said, Operation Perfect, maybe I'll come in for a facelift next time. Well, he documented a normal heart exam, gave a little bit more morphine. This is appropriate dose. Dr. Thorpe-Jarnason was on call that weekend for emergencies, and he was coming in to do a gastrectomy for a bleeding duodenal ulcer, but he stopped by to see Andy before the operation at 7:30. And Andy was up walking, he was in the bathroom urinating, he was having a good time, all was well. At 8 o'clock, the private duty nurse Minchu came on, and at that time he was stable, normal vital signs. He was watching The Love Boat on TV. It's amazing how many people have written about this. So I know all the TV shows he was watching because friends and neighbors were visiting him and documenting this and later in essays in the newspapers. And he had several young male visitors, never quite identified who they were, but they were mentioned. And some people later think that they may have been bringing in some of these stimulant drugs for him that were separate from what he was getting from the hospital. It's really not known, it's just been suggested. At 10 o'clock, he had normal vital signs. He was watching Archie Bunker, All in the Family there for Edith. 11 o'clock, he's watching reruns of Dallas. There was a report given to this chief surgical resident who called up after the gastrectomy operation was done. And he called to see how he was doing. The nurse said fine, so they didn't come by to see him then. But 11:30, he was very excited. He wanted to watch Willie Nelson, the host of Saturday Night Live, because Dana Garvey, the church lady, was going to be on. And then his old friend, Dennis Hopper, was one of the guests, and Andy had painted Dennis Hopper back in 1971. And finally, at 2 a.m., he's normal vital signs, he's still watching Mork and Mindy. Stop watching that TV, so the nurse turned it off and told him to get to bed. Later, apparently she changed into some more comfortable clothes. This would be important also in some legal trials. At 4 o'clock, normal vital signs were recorded in the chart now. The hospital accused the nurse later that maybe she did this after he was already dead and put those vital signs down. But you know, a lot of nurses don't do all their charting every second. They sometimes wait till the end of shift to put it down. I'm being defensive for the nurse because she's going to be blamed for a lot of this. Anyway, at 5:45 a.m., she finds him blue, no pulse. And she calls for help, and they do a big code blue, the name for a cardiac, event. She was accused of being asleep, and then he died many minutes or half hour or something before. They accused her. I don't know where the evidence for that was. I'll show you some things. So there was a full code of situation, resuscitation, put a tube in the windpipe. He was defibrillated with a cardiac conversion 3 times, and each time his cardiac rhythm came back to normal. So that tells me he hadn't been dead too long when they found him. Otherwise, I don't think the heart would have come back. He had at least three different intravenously stuck in him to give him 7 different kinds of medicines and try and revive him. All the different things that you do for a full cardiac code resuscitation, but also a lot of fluid. And they're doing chest compression and all. Dozens of professionals were there, but at 6:21 he's declared dead. And Dr. Thorpe had been called and he was coming in, but anyway, he was on his way to the morgue by the time Dr. Thorpe Johnson got there. He was dead, real dead. Newspapers proclaimed it. So now, what's a medical center to do when something like this happens, which is an unexpected bad outcome? Everyone thought he was doing well, and then boom, dead. And what should be done, and what was done? Well, I just want to let you know that in this city, in this state, there's a movement, and I'm a little bit part of it, a movement started by Dr. Tom Gallagher over at the University of Washington, a professor of medicine. It's got a program name, and it does something we can talk more about it at the end, but Communication and Resolution Program. And the purpose of this is when there is an adverse event, to get learning from it and accountability. And there's a whole raft of things that is appropriate to do, and here they all are. And to kind of go down that blue line, these are different categories of things about reporting and communicating with the family and analyzing what had happened, getting to improve things, trying to find out the root cause analysis, give financial resolution to the family if it's appropriate, care for the emotional needs of the caregiver, and keep the family involved until, in other words, you do what you'd kind of expect you'd want somebody to do if this happened to one of your friends or relatives. And the traditional response in medicine probably hadn't been very good. Sometimes this is not reported. People deny or don't tell the whole truth about it. If anybody's to blame, it's the doctor or the nurse. Rather than what we should do is we should report this to the medical center immediately, communicate with the family what had happened, promise the family you're going to find out what the cause was, and you don't try to blame somebody, but you try to figure out something that went wrong systematically that you might do to prevent it from happening again. In the old days, it's the doctor's fault, send them back to school, have the nurse go take a course. But now it's to really find what went wrong and then disseminate those learnings through the medical center. Financial resolution, no, don't give the family any money, only if there's a lawsuit and you lose. There wasn't much thought that a tragedy like this is really hard on the people that are involved from the doctor point of view and the nurse's point of view, so offer them emotional support and then keep the family involved. So these are the things that are part of this communication and resolution program, and we're on a committee statewide, and we should actually certify that a medical center has done the right thing. And the whole purpose of this is to try and drive the culture and change the culture to do what you'd expect should be done. Because if you don't do this, you're going to compound the suffering of the patient, the family, and the physicians. You'll increase likelihood of litigation if you don't come clean and do the right thing to people. You're going to lose an opportunity to learn what really went wrong and then to spread those learnings across the institution. This degrades your culture when you're being dishonest or not forthright or transparent. And that reduces public trust in healthcare. So, just quick review. What should the New York hospital do? Should they hide and hope, blame and shame, pursue and punish, deny and defend? No, those are all wrong. What you want to do is give sympathy to the family, so it's just promise you're going to find out the cause of death or whatever the problem is. do a scientific root cause analysis and with experts to try and really think about what could have been done differently, find those problems, institute changes in the institution so these are very unlikely to happen again, communicate back to the family, compensate the family if appropriate, care for the emotional needs of the caregiver. Well, let's see what happened in New York. Let's see what happened. Everyone was involved, all types of bureaucracy involved, including the newspapers. The artist died in New York Hospital where he underwent gallbladder surgery. Condition was stable, but he died of a heart attack around 5:30 a.m. The article went on to quote the chief medical examiner, Elliot Gross, and who said this is a very unusual type of death. And he said, you know, an unexplained death of a relatively young person in apparently good health. This is a presidential statement. This is done before the autopsy or before he knew anything about the case. He says, Andy Warhol died in the hospital after gallbladder surgery. This is bad. I mean, the medical examiner's already put out the information. So that next day, Monday morning, he died Sunday morning. Operated Saturday, died Sunday. Monday, the autopsy's done. It was conducted by the deputy chief medical examiner and by the chief. And the findings published that day was that there had not been a blockage of the coronary arteries. He didn't really have a heart attack. Now, an arrhythmia of the heart is different. The heart just stops and quivers. That's different than a heart attack. But he didn't have a heart attack. He hadn't aspirated gastric contents into the windpipe. He hadn't hemorrhage in the abdomen. The operative sites all looked perfect. But he did have heavy lungs, and he weighed a lot more than he did when he came into the hospital. And this would become a major factor in the case. And they wanted to interview the hospital personnel before they gave a final report. Now, this is in February. The final report came out in April. And in it, the cause of death, cardiac arrhythmia, the abnormal beating of the heart, not a real heart attack, but of undetermined origin. And then they made some quite amazing statements to me. Cardiac arrest occurred a significant time before notification of a cardiac code. Chart notes do not adequately reflect status. They put the nurse in the bullseye. And they didn't stop there. Warhol's death warrants investigation by the office of the district attorney. They didn't just want to say she had bad practice. They wanted to prosecute her for murder, a crime. That's why you go to the district attorney. And the district attorney, Robert Morgenthau, who became a legendary figure in New York, I think he was district attorney for 34 years. He was a younger man at the time, but he said, "Where's the toxicology report?" And they said, "Well, wow, you know, he's already been buried." 5 days later, no toxicology report. Now, this Elliot Gross, I'd have to say, had a checkered career. Because he was fired later on. Here's why. A number of young blacks and Hispanic people had been arrested during his tenure, and they died in police custody. These young, healthy criminals, I don't know if they were arrested, I don't know if they're criminals or not, but they... And all the autopsy reports said they died of natural causes. Well, the mayor didn't really see it that way, and a few months after Warhol's thing, Elliot Gross was actually fired. Now, the district attorney had to look at Dr. Cox and Dr. Thorjarnason and the nurse and the massage therapist, because some of the doctors started criticizing the massage therapist as the cause of his death. But he really had to look at Min Chu. There's rumors that she'd been reading her Bible and not watching Andy very carefully, or not charting appropriately, or maybe she'd fallen asleep. But the New York hospital had already decided her fate. They kind of thrown her under the bus. Because the next day they barred her from working there, and a couple weeks later she was barred for life from working in the New York hospital. He looked at this Lindy Lee, because both Dr. Cox and Dr. Burke had blamed her for mashing the gallbladder during the massage a week before he went to the hospital. But eventually, after a few months of investigation, the district attorney wrote a letter back to Dr. Gross, who was still on the job. He'd be fired a couple months later, but insufficient evidence to bring charges over the Warhol case. The caregivers were not criminally responsible. It's not a homicide. No grand jury investigation necessary. There may have been poor medical records. It's unknown whether more vigilant nursing care would have detected the fatal arrhythmia in time, because his heart rhythm was not being electrically monitored. So for me, Morgenthau gets a big red star because he's the only one that really has done a root cause analysis. What could have been done differently? You know, really, if they'd known about these drugs that he was taking and other things, maybe they would have had him in a better monitored situation. So the second heart arrhythmia started, they could have defibrillated him and taken care of things. So it takes the prosecutor to come up with, you know, the hospital's not investigating this, the doctors aren't. The health department, they went crazy too. They picked anything they could find wrong with the chart. There was no rectal exam as though that would have mattered. The penicillin we talked about, the nasogastric tube, that's a tube that goes down to your stomach. Well, he didn't have tracheal aspiration, so whether that was working or not really is irrelevant. Input and output not perfectly recorded. And they castigated the nurse for record keeping. And they kind of all got on this overhydration thing, that he had too much intravenous fluid. But I disagree. Just personally, I disagree. He had 3 liters when he came in on Friday. He had a bunch of intravenous fluid during the operation and more because he seemed dehydrated after this major abdominal surgery. And then he got a lot of fluid during the resuscitation on Sunday morning. So this extra weight and fluid that he had, to me, was appropriate. And much of it came when he was already dead. So, but the New York Health Department, they had their report. Well, let's fine or otherwise punish the institution over the Warhol case. Well, that's kind of the opposite of what we're trying to get hospitals to do now. We'd rather have find something to improve rather than someone to punish. But of course, there's going to be a lawsuit here. The brothers and the estate. Warhol was tremendously rich. There was probably no artist ever as rich as Warhol in his lifetime. You know, I mean, things, obviously some of the things have sold for more, but during his lifetime, he was fabulously wealthy. He's left this whole museum in Pittsburgh and endowments for the arts. He's done a lot of things. Well, anyway, the brothers in the state are suing the New York hospital because of this fluid administration. Well, during this period, now when you get back to work hours, the New York Health Department was not only investigating the New York hospital for Warhol's death, but 3 years before, there had been a death of a woman named Libby Zion, and I think most of the doctors in the room probably recognize the name of this case. It's an unusual case. It was a young college student who died 3 years before Warhol when she came to the New York hospital, and she got in there, and a few hours later she died. It was never clear whether it was drugs or a horrible case of the flu or what it was. But the health department was trying to find someone to blame, so they started the investigation late, right after Warhol's death. There were 30 public hearings about Libby Zion at the same time Warhol was in the newspaper almost every day. And really, eventually, they couldn't find anyone really to blame except for the young doctors in training, the house officers, the residents were being overworked. And this led to something that's just almost impossible to admit to a lay audience. But because of this, reforms were made throughout the country, and the residents were now only allowed to work 80 hours a week. When I say only 80 a week, I mean, it's crazy, but that was a big improvement on what was happening in the time when I know the doctors in this room trained, and when I trained, it was, you know, much more. Anyway, the point for this report is that the New York hospital was under attack because of these investigations about Libby Zion and about Andy Warhol. And what do you do when you're under attack? Well, you just change the CEO at the top. And so Dr. David Skinner, a very well-respected surgeon from Chicago, came in. Just on a personal note, I interviewed in 1977, 10 years before, to take a job at the University of Chicago under Dr. David Skinner, but I also interviewed at Virginia Mason, and I'm so glad I came here because I might have been pulled back to New York and been part of this whole deal. Anyway, he came in, and he made a statement that's very true. You know, we're sorry, but those things happen when you have a severely gangrenous gallbladder. But guess what? The press didn't pick up on this. Here we go. August 16, 1987. Died at the hospital after routine gallbladder surgery. New York Times Magazine in 88. Only 0.2% of patients under 60 die after routine gallbladder surgery. Biographer in 1989, the chance of dying from routine gallbladder surgery 1,000 to 1. Associated Press in 1991, this is when the trial started to go, the malpractice trial. Warhol died because of negligent care. He's undergone routine gallbladder surgery. And then I like it from England later on in 94. Andy went in for ordinary gallbladder surgery. He shouldn't have died, but my favorite, an internet critic just a couple of years ago, Warhol died in '87 after a minor operation to his gallbladder. I don't know where these guys get their words. Minor operation to the gallbladder, you know, the outcome of an operation is not dependent upon the name of the operation. It's dependent on patient factors and diagnosis. And as we've mentioned, Warhol had this severely gangrenous gallbladder. As a patient, he'd been sick for a month at least. He'd had these symptoms for years. He'd had this major prior operation, adhesions, a giant incisional hernia. He was dehydrated, deceptive about his drugs, and was he taking uppers and downers at the time? So eventually, all the people agreed that this was, this is not minor surgery, and this is not routine surgery. But people did agree that the cause of death was ventricular fibrillation, this abnormal beating of your heart that doesn't pump any blood, that eventually you just drop dead. And I think the cause of this was just a panic attack when he woke up in the early morning in unfamiliar surroundings. He had pathologic fears of hospitals, and whether more uppers caused this, I don't know. It's hard to know. Dr. Skinner also said later on, the soft spot in the Warhol case is that no one really knows what happened in the hours before he was pronounced dead. That says something about the nursing care that night. Back in the bullseye. Well, the trial started 3.5 years later. You know, it takes a while to get these malpractice trials going. And the Warhol brothers and the estate were suing the doctors in the hospital. Everyone had lawyers. This fellow, Bruce Clark, was a pretty active and aggressive plaintiff's attorney. And he gave the opening statement for the family suing the hospital. And it was quoted in the New York Times, so I know exactly what he said. Warhol was 5 feet 11 tall. He weighed 128 pounds. His doctor said that he was in good health. That pumped him full through the veins. The fluids drowned him. Where were they? No doctor looked in on him. Well, that's totally untrue. The floor nurse had never looked in. Untrue. The only one to inquire about Andy Warhol's condition was a resident in training. I mean, how low can you go? Where were they? Mr. Warhol was given morphine to suppress his pulmonary capacity. I mean, you want to give a little, you've got to be humane to get a little shot after a major surgery like this for pain. At his autopsy, doctors gave his weight 150 pounds. His lungs were filled with fluid. Where were they? Well, 150 pounds, remember he was 128 in the office several days before. That's a gain of 22 pounds. 22 pounds is 10 sacks of intravenous fluid. And I've kind of gone through that. I think he had the appropriate amount of fluid given to him. And maybe some of the excess was after he was already dead. It's hard to get rid of the fluid that pump in you when you're dead. You know. The tragic thing in this case is that Warhol's condition would have been easy to treat, but everyone in the hospital dropped the ball. Now the defense attorneys, we're almost done here, the defense attorneys said, Warhol passed silently and quietly asleep by cardiac arrest. Too much fluid didn't cause the heart condition. In my own personal opinion, is they're correct. But Bruce Clark is going to win this case, just to let you know. Later, he was quoted in the paper, liability means knocking the defendant down and then stamping on him so bad they can't get up and doing it in a way the jury does not feel sorry for him. It's that factor that makes the jury so angry at the defendant that they cannot wait to punish him. I guess we're just trying to get away from that type of philosophy and trying to figure out what went wrong and how it could be prevented for the future, you know, appropriately take care of the family. Well, after 3 weeks in the trial, before everyone had had a chance to testify, the hospital gave up, and there was a $3 million out-of-court settlement. But I can tell you Dr. Thorpe Jarnerson was not happy. By this time, he'd completely retired. He was proud of the work he'd done. He thought the post-operative care was appropriate, and he wanted to kind of keep fighting this, but, you know, conceivably, for financial reasons, they settled for out of court. But I can tell you, he carried this with him for the rest of his life. But let's review what happened. The newspapers, they didn't get it right. The medical examiner wanted to prosecute a nurse for murder. New York Health Department cherry-picked the chart. The New York hospital blamed the nurse. Dr. Skinner wasn't totally helpful. Dr. Cox and Dr. Burke tried to blame the massage therapist. And I guess the malpractice attorney was doing his job, but maybe we should get a better system. I do know this, that for me, the stars were the district attorney who did a root cause analysis, suggested things that could be done. I think things that we would do almost automatically now is to monitor a patient, in a more of an ICU center, at least the pulse oximeters and cardio. I mean, if anybody's been in the hospital recently, I think you can't be in a hospital without those things on you overnight, even if you're 25 years old and perfect. And I think Dr. Bornthorpe Jarnison, I just feel sorry for him. I mean, at the height of his career, toward the end of his career, he did a beautiful operation, and then, to have it, and clearly no one cared for his emotional needs, because he's still carrying that burden 30 years later with him. So, kind of in summary, I'd just like to say that we should be looking for something to change rather than someone to blame. And then, on a personal note, I gave this talk about it a little over a year ago, and it was actually quoted in the New York Times. I can tell you, if you're quoted in the New York Times, your siblings and your children look at you in an entirely different light. I mean, the big point of the article was this wasn't routine at all, that Warhol was very sick, and this would happen in a few percentages of cases. But then, something really cool happened, at least for me, is the author said that I was a jolly and sporty Seattleite. When you're looking at 75, that's a good moment, but I didn't want to let it go to my head because I remembered something that a famous man once said. So, thank you very much.
Thank you. Before you ask questions, I just want to thank Dr. Ryan. That was one of the more interesting talks I've heard here, so thank you so much. Shirley, you had a question, so I'll give you the mic. You're disappearing.
What happened to the...
Well, you have to speak in the mic, please.
I'm not totally sure. I couldn't ever find out what happened to the nurse. She asked what happened to the nurse. She was, her malpractice insurance was part of the settlement. She was barred for life from the hospital, so apparently she never came back there. She probably found work somewhere else.
Probably sued him too.
Yeah, nowadays she would. I couldn't find. I looked for her on the internet, and I couldn't find anything more about her. And Dr. Thorpe Jarnison didn't know.
What happened to the woman that shot him?
She was convicted of attempted murder.